Hello and welcome to my channel Direct from Doctor, and my name is Dr. Shanay, and in my channel I'll be talking about health problems only and the solutions for the health problem if available, and various disorders. So this is a continuing channel. I'll be adding a lot of videos, so please go back to my older videos as well. There was a time gap in between because I was outside, but now onwards I'll be continuing and adding more videos. Please do listen to my videos. I'll be explaining the things in a very simple layman manner, so I'll not complicate the things, so that easily you should understand what I'm talking about. Just what you ought to know, I'll tell. Okay, so please share these videos with your friends, and subscribe to my channel, like it, share it, please. Okay, so that I can grow my channel. So today's topic, we'll talk about dengue. Dengue, we call it as dengue or dengue. And both the ways you can pronounce it. These days it has become a topic. So you switch on the TV in my area. So I live in Bangalore, and I get local channels of Karnataka state, and you switch on the channel, they are talking a lot about dengue fever, because it's a rainy season and a lot of water logging in many areas, and it breeds the mosquitoes, and these mosquitoes can cause dengue fever. So we should know what is dengue in that case. Many people still don't know what is dengue. They confuse it with malaria. Malaria is slightly different, dengue is different. Both are spread by the mosquitoes, but these mosquitoes are different. For malaria it's different. It's called as female anaphylis, that mosquito name. In dengue it's called as Aedes aegypti. It's like a technical name, Aedes aegypti. So that is the name of the mosquito. There is also a female mosquito. The female Aedes aegypti, only that mosquito can spread dengue fever. Dengue virus. So how it spreads? For example, a person is suffering from that fever, that is carrying that virus. So this mosquito goes and bites him. Okay, bites him and sucks the blood. So immediately thousands of virus go into the system of that mosquito. So it has to be that mosquito only, no other mosquito. Aedes aegypti. That is called as a vector. We call it as a vector, the carrier. It carries from person to person, and that mosquito itself doesn't suffer. Then nothing will happen to the mosquito. It's just a carrier. So it absorbs that blood and dwells in the salivary glands of that mosquito. That mosquito goes and bites another healthy person. So it's injected into that person. So from the person who is suffering, it has gone to another person because of just one mosquito. Just one mosquito can really cause a havoc. And that mosquito itself will not suffer. That's a joke, actually. And mosquito, but as long once it is sucked the blood from that particular suffering person, that as long as that mosquito lives, it is there in that mosquito system. It can go on infecting the people. See, that is the wonder. And but the age of the mosquito is the lifespan of the mosquito is very less, a few days. In a matter of few days, the mosquito will die naturally. But I think by the time it has created havoc. So once it spreads like that, it takes the virus and injects into another person, a healthy person, that person gets infected and suffers. When I say suffer, actual suffering may not be there. So that person may not even know that suppose I get bitten by that mosquito, I may not even know that I have dengue. See, actually what happens is some people never suffer. Nothing will happen to them. It will be there within the mouth. It will be there within the body, in the system, but that person does not suffer. Asymptomatic. We call it as asymptomatic, and in that case, that person becomes a carrier. Means the person carries those viruses, but apparently doesn't suffer. If the patient suffers, in that case, the person may get fever, severe headache, vomiting, a lot of issues which are usually found in regular flu. Even worse symptoms will come, and it's really debilitating. The person becomes really weak. So, but usually once the symptoms start showing, 3 to 7 days, the person becomes all right. There is no cure for dengue fever. There is no cure. The person has to become all right by himself. Only supportive therapy like rehydration and reducing the fever by antipyretic tablets. We call it antipyretic, means reducing the fever, and just treating the symptoms. That's all is the treatment, and nothing is available. That person has to become all right by himself. Okay. But in the severe cases, some cases become so severe that platelet in the person comes down, platelet count. See, in the blood there are various type of cells called as red blood corpuscles, white blood corpuscles and platelets. So this platelet count has to be from 1.5 lakhs, that is 150,000 to 400,000, 4 lakhs. Okay, that count has to be that much. If it comes down, then 150,000, then there is a serious problem, because platelets are responsible for main ingredient required for clotting the blood. Means clotting mechanism fails within the body. So there may be multiple hemorrhagic spots. Internal bleeding may happen within the body, or external bleeding may happen. There will be bleeding spots. That is called as dengue hemorrhagic fever, we call it as. That is a severe form of dengue. Very rarely it happens. Very small percentage of the people suffer from hemorrhagic fever. But once hemorrhagic fever comes, then it's a very, very serious matter. Patient needs hospitalization, and a lot of treatment is necessary, and by luck the patient survives. But certain patients die because of this. This is very rare, but death because of dengue is very rare. And when they say around 1,000 people have got dengue in the town, it may not be true. It may be 10,000, because symptoms are not shown in some people, as I told in the beginning. They become asymptomatic. They just become carriers. Because of them, the thing goes to another person. But that mosquito has to be there. That mosquito has to bite, take that virus and inject into another person. That mosquito control is very much necessary. So during the monsoon, you have to see that mosquito control is good. Within your room also, sit under fan, or suppose mosquitoes arise. In some areas there are no mosquitoes. The water logging should be avoided, and particularly in our areas, they drink a lot of tender coconut and just throw it. And it attracts a lot of mosquitoes. So anything that attacks the mosquitoes should be kept away. So that way, if you control the mosquitoes, as I told in the beginning, every mosquito, if you bite, it doesn't cause dengue. Only that particular mosquito called as Aedes aegypti. But how to identify that? Suppose there are around 100 mosquitoes around you. There may not be even one Aedes aegypti mosquito. Or there may be, out of 150 may be Aedes aegypti. But that Aedes aegypti mosquito also may not be having that virus inside, because it has not yet bitten that person who is suffering. So it's all a chance factor. It's a lottery, Okay. So you have to be careful that you don't get into these kind of things. Mosquito control in your area is utmost. You see a lot of mosquitoes, please report to the authorities and let them control the mosquitoes. That is a better way of controlling these kind of things, dengue and malaria. About malaria, I'll talk some other day. Today I was talking because it has become topic in my area. Anyway, so stay away from the mosquitoes, stay healthy. So that's all for today, and I hope you understand what I wanted to talk about. Again, I have not gone into the depth of what is dengue, but this is enough to know. Okay, so all the best. We'll see you in the next video. Take care.